Hello and welcome to this video. We're going to be talking today how it is possible to have long-term remission of type 2 diabetes. I'm Theresa Garnero.
And I'm Stephanie Bouquet, and we are both certified diabetes educators. I'm also a registered dietitian, and Theresa is a registered nurse.
That's right. And it's with excitement to share this talk about what you can do to reverse type 2. And I just want to start with sort of the notion that science takes time. It takes time to do the research and to accept the findings, to validate them, and then to finally change the way we do things. I don't remember where this research came from, but it's like 17 years between the time that it's discovered and the time that it's actually part of the mainstream medical science practice. I have to say that the COVID vaccine was unique in how quickly that came about. But in relation to this talk with reversing type 2 diabetes, I'm going to talk about somewhat of a dark horse, this researcher out of the UK, who I remember, Stephanie, do you remember hearing about reversing type 2 diabetes? And it was presented at the American Diabetes Association conference. And it's like, how is this possible?
Right. Oh, I do. And I remember thinking it can't be reversed.
Yeah.
It can't go into remission.
Right, because once the beta cell dies, that's it. It's dead. It's gone. And really, that's not necessarily the case. So I want to quickly just talk briefly about the current standards of care for type 2 diabetes. This is by the American Diabetes Association. And you can see this algorithm where the person is in the center and the goal is to prevent complications. And there are several steps along the way, which, you're welcome to pause and read through. I mean, all of these are important. But one thing I have to say is that within each one of these goals of care, we kind of tiptoe around managing weight. It's not really the central priority, although it is gaining some momentum and traction, and there's more conversations about it, more publications coming out about, hey, wait a minute, we actually should make this more of an emphasis for those who are carrying extra weight than getting the A1C down. So to be determined, right? This is it's really interesting to see how just in my couple decades in diabetes, how the emphasis is starting to shift. And really, I know when we talk about diabetes prevention, it's very much focused on managing weight. But I'm curious to see what's going to happen in the world of type 2 diabetes coming up in the near future.
Yeah, it's really interesting. And I think you're right. It has not been the priority, but I think it is now creeping in, which
like here,
very good.
It says here clinical characteristics like age, A1C, and weight is sort of off to the side. And
right.
Yeah. And I know that even discussing weight is not always a comfortable topic for a lot of clinicians and a lot of patients. And so we just sort of don't really get into it, but we do know that it helps type 2. What we have been doing is small changes over time, do one thing at a time, you adjust it slowly, you make goals that are realistic, but how effective is it? I mean, I've seen it be very effective, those small changes.
Sure.
Yeah, not everybody can do that, but they are effective. But does it get you to a point where your type 2 is going to go into remission? And the answer to that is oftentimes not.
Right.
Most people will have to be managed with medications as well as healthy eating and being active and healthy coping. But I like to think of it so that is the state of affairs now. We kind of, if you're going into a cold pool, are you going to go in like an inch at a time? Or are you just going to jump in and get it over with? So what if there was a quicker way, the jump in the cold pool routine? And there is. And the dark horse I mentioned, Dr. Roy Taylor, He published research about completely reversing type 2 diabetes through rapid weight loss. And he's funded by the National Institutes of Health. So he's not some quack. Medical term for crazy person. He's not like selling snake oil. But it's tough to get there. Basically, it's a strict calorie reduction approach using meal supplements and one non-starchy meal of veggies per day with family support and absolutely no extra exercise added, because it's like focus on one thing, focus on the diet, because people can out eat any exercise routine.
Right.
And what he found is that it's very effective in getting type 2 into remission, especially so for those of you who have been recently diagnosed, less than 6 years. I mean, a lot of you may fit into this category. It's most effective with that group of individuals, but it's also worked with people who have had type 2 up to 23 years. So you don't really know until you try. And this was through his counterbalance study. He talked about the twin cycles of obesity and its impact on type 2, just sort of, and I know we've talked about this, when you eat more, the liver fat increases, and then that leads to insulin resistance. And then, it's just this vicious cycle that just, the liver gets fat, it can't keep up, that fat gets passed on to the pancreas. And that's the organ that makes the insulin, and that's not good. So it doesn't cover your food.
Well, and I think, I'm just kind of thinking about this, seeing this as a perspective of, someone that has diabetes that's listening to us. They might say, well, yeah, I would really like to lose weight, but am I willing to follow such a strict protocol? And so I think it's on an individual basis, but it's kind of exciting that, wow, there could be this breakthrough that could really help manage the diabetes.
That's right. And it's a tough decision. So people are faced with, I think it's really important for everyone to make their own decision about this. Like, you have to know, hey, can I have two little pre-made shakes for my meals, and one meal that's a low carb, veggie rich diet meal for my third meal? And can I do this? And people need to know that this is an option versus, okay. And you remember that earlier slide when we talked about all of these things. Well, we're going to assess all that. We're going to give you medication. We're going to tell you exercise and eating right. And here it should be like, one of the things should be, hey, if you want to do rapid weight loss, if that's the direction you want to take, this is something that is really working. His trial is called the DIRECT trial. You can get complete information at this website here. I just checked it. It is working and fine, and it's really impressive. So yeah, the defect of the liver and pancreas can be corrected through substantial weight loss. But again, this is, it's not for everybody. So I think as medical professionals, we have an obligation to let people know this is an option. Most people don't know.
Right.
So step 1, low calorie weight loss over 2 months to lose 15%. Oh yeah, that's easy. 15%. 33 pounds. That's a lot of work, so
That's a lot of work.
You got to be dedicated, have your family on board, work with a dietitian. And that's like 600 to 700 calories from a liquid diet. And then, so, you work with your physician or your nurse practitioner or prescriber, because your medications are going to not be needed as much, and there's going to need to be some changes there. And then step 2 is return to normal eating. So it's like, boom, get your pancreas, get everything into a place where you're in a safe zone and your sugars have come down more into the target. And then how do you gradually in return to normal eating, and then the maintenance. He outlines all of this, and I'm not getting any royalties. I bought his book because I was like curious about it, and it's very well written. It's written in layman's terms, very easy to understand. It's called Life Without Diabetes. And so we're not here giving you medical advice, but we are here telling you about some options. You can certainly find out more about it on his website. Definitely discuss it with your doctor, provider, diabetes educator before doing this, because a lot of your pills, even blood pressure and cholesterol medications, so people will go off the table. You won't need them. Same for diabetes. So people are like, okay, can I do this and then, get rid of these medications? Or I know myself, there's no way I'm going to be able to do 600-700 calories in meal replacement for 2 months. You have to know, so I just want
Exactly. And
Yeah.
I think how you had mentioned too, the hardest part is returning to normal eating, and maintenance. And so making sure, if you're going to do this, that you have a plan set out for that part of it as well, so
Right.
the care to help with that. Yeah.
So with that, we thank you for your attention. We wanted to provide you with some additional topics that are timely, that you might not hear about in the mainstream diabetes education type situation. And we hope that you have found these useful, and you've picked up tips along the way that you can integrate and stay safe and be healthy with diabetes. So thank you so very much.
Thank you.